In terms of seal decay, it's a little bit more complicated. You can do a one-step or a two-step. Now, it was interesting that I had not heard from Dr. Lynch that he no longer does a two-step. I have found that too, because the only reason that we did the two-step, the idea, I'll go over what I mean by the two-step in a moment, is we weren't sure that the ozone was working. But time after time, as soon as I took out the old filling material in the two-step procedure, I found out that the dentin was hard. It was remineralized. So why did I have to have the patient go through the procedure again? So I, as well, had stopped doing the two-step. What I mean by the one-step is a single appointment procedure. Every single time I do a filling, every time I do a restoration where I remove caries, I always use ozone. There's a decreased chance for redecay, and the patient is confident, and I'm confident. It's a long-term benefit. Two-step, what we did do in the past is when a very large decayed surface came in where I thought, okay, this might need a root canal. What I'm going to do is I'm going to remove all the soft material, then I'm going to use ozone, then I'm going to fill it with a glass ionomer, and I'm hoping that the patient will not need an endo. And about 90% of the cases, patients did not need an endo. I would remove the substance and then check it afterwards. I saw that the dentin was hard. So I was very happy, the patient was happy, and I've had cases 5 years down the line where the patient has not needed a root canal. So with a two-step appointment, you have 2 appointments, you eliminate the bacterial activity, again, the patient has confidence, and you may avoid their having to have a root canal. So we're saving teeth. One-step technique. We go in with a very small burr. Usually I use the SS White fissurotomy burr, or you can use a microabrasion technique. I still like a burr in my hand because I like the feel of the burr, I guess that, but these are very, very small burrs that are minimally invasive, for sure. It's clean. We use ozone on this, and we're certain that we've eliminated all the bacteria. So I'm confident, and my patients are confident. We bond normally. We put in the filling material. We prepare the filling material to the proper configuration. We polish. We polish it first in terms of the proper shape. Then we cure it. And then we polish it again, and there we are. We're completely confident that this is not going to redecay. First of all, with ozone, redecay is less, is definitely not going to happen as often. We know that the surface is a lot more resistant. We haven't found redecay, and every restoration should be treated this way. The two-step technique has now become the one-step technique. But at the time, just to convince myself, I needed to know that the soft, leathery type of dentin became solid and was no longer something that I was worried that it was infected dentin I would remove. It's the affected dentin I'm talking about. It's that soft, leathery material that no longer was affected dentin. It was hard, healthy dentin. So now the two-step technique is not really something that we're using, but I'm just showing it to you as it developed in my mind and the way I did the technique. So we clean out all the material, get rid of all the infected dentin, everything that's soft and has a very high bacterial content. We clean it out with a slow-speed round burr, and then we ozonate. Then we can, and sometimes I did put a remineralizing solution. Sometimes I did not put a remineralizing solution. What I was doing more often was just putting in a glass ionomer. Glass ionomer remineralizes anyways. So you've got the minerals, you've got the fluoride coming out of the glass ionomer. So you don't really need to put in this remineralizing solution. It's an extra step. It can be done, but it's not a necessary step. So then you put in glass ionomer, And you leave it in for up to 6 months. Within 6 months, it was totally hard. We removed the glass ionomer. And when you go into this material, that is healthy, hard dentin. Totally healed, hard dentin, no longer leathery, no longer affected. You're complete, and you've saved the patient having to have a root canal. And as I said, all the patients that I've done this, at least 95% of the patients I've worked on with this technique have not needed a root canal over 5 to 7 years. You re-ozonate it here, and then you fill it with a permanent material. This second step is not necessary. What I would do now is eliminate the soft material, leave about 1 millimeter if I have to, of decay, maybe affected dentin that's a little bit leathery, then put in a glass ionomer base and fill it on the top with a regular composite resin. That's what I would do today. So here what we're doing, we're finishing it off after we've removed the glass ionomer and putting in a regular filling material, a regular composite filling material. So what are the treatment, the dental or dentin hard tissue materials? What are the benefits of ozone? We've got restorative predictability. We're decreasing our invasiveness. We're creating a stronger, caries-resistant dentition. There's less trauma, less pain, less fear from the patient. Less anesthesia is required, because sometimes on most of these patients I didn't have to use any anesthesia. You can go in slowly and not need the anesthesia. And it's a natural healing process or proactive intervention, depending on whether you like the healing aspect or you like it as proactive intervention if you're more scientifically inclined. I hope to make everybody interested in this. And it appeals to patients and it appeals to dentists as well. So I just feel that hopefully my enthusiasm and is getting you all excited. We've had a lot of very enthusiastic people all afternoon, and it's amazing that all of you are here when the weather and the beautiful island and everything else is catching you over there. I believe that ozonics is now the present and future. Remember, Ozone was a pioneer, a very good pioneer. Ozonics is the present and it's the future. It's a great medical device. It's an in situ ozone generator. That's how it works. No vacuum pump is necessary. No neutralizing filter is necessary. No sealing caps are necessary. That sealed the sealing and creating that vacuum, which was so difficult and not usable on a lot of soft tissue surfaces, that's no longer needed. So that's why I do believe that this is an easier system, less of a learning curve, and it is the present and the future of ozone treatment. I'm hoping that I've helped you rediscover healing dentistry, the idea that less is probably more. Let's give Mother Nature a little bit more of a chance to work her business, her or his business, whatever, Mother or Father Nature, whatever we want to say, and work together with nature, because less is more. Thank you very much for your attention, and we'll be here for more questions.